And this segment of this special 1-hour Newsmaker show welcoming Dr. Ismail Mehr, the Hornell anesthesiologist.
Hey, thank you so much.
I understand you have a COVID-19 team. Can you tell us about that?
Yeah, so, when we started doing our preparations, again, we have no idea. We did not know if we would even see any patients. We'd have a huge surge, what would take place. So we always prepare for multiple scenarios. Our job is to prepare for the worst, hope for the best. And hopefully things so far are falling in between right now. We've been quite busy here since Friday last night till now. We've had quite a number of COVID patients come through. Patients come through who are showing signs and symptoms very consistent with COVID, who need to be admitted to the hospital, and we get them tested and they come back as COVID positive. Patients who come to the emergency room who have advanced very fast, progressed very fast in the disease process of COVID. They necessarily haven't been tested yet, but we know it's COVID because we've seen it now enough and understand it in terms of symptomology. And those patients need some critical care done in the emergency room and need to be sent to the university up to strong. So what we did starting last week, actually, I believe it was this past week, Monday or Tuesday, we put together a COVID team. And, in the hospital, we have our hospitalists who do a tremendous job. Dr. Randhawa is the lead, and we have Dr. Sachin and Dr. Shane Varghese and Dr. Sachin Mann. So we have three hospitalists. One hospitalist is on, normal routine business as usual at St. James, that we've always had a hospitalist that covers and admits and takes care of the patients. When you start getting the COVID-19 population that's being admitted, there's a little bit more acuity to those patients in the sense that there's a lot of management in terms of their oxygen levels, some additional labs we look at known as blood gases, and just sort of taking care of them from a sort of a critical care standpoint, not necessarily ICU. So what we had in our planning stages planned out is that we would add a sort of a COVID team of physicians and mid-level providers to assist our hospitalists so that they can focus and take care of all the patients in the hospital, including the COVID-19 patients, address all their other medical problems and diseases. But the COVID team is sort of helping them manage and take care of the calls and management issues around the oxygen and some of the little bit more critical care things. And being an anesthesiologist, we also do an extensive time and training in intensive care medicine in ICU. And many of the ICUs around the country are actually led and supervised or directors, the medical directors for most major ICUs around the country are usually anesthesiologists. By no means am I an ICU fellowship trained, meaning that I did additional multiple years of training in it, but we've trained in it quite extensively when I was a resident. So I was asked to take the lead in being the lead doctor for the COVID team. So what we're doing is we're assisting our fellow hospitalists. We're helping taking some of the hour-to-hour changes that need to take place with oxygen levels and blood gases and decisions in when or when not to intubate and prepare them, to be put on a ventilator. So that's what we're doing. It's myself, Courtney Quinlan, who is our physician assistant, has joined us recently, related to the Quinlan family in town, and also Jack Florio, who many of you know. He's an excellent PA who works in the emergency department, has some extensive experience in managing and assisting in ICU care as well. So the three of us are helping our local hospitalists in doing that. And it's really, really been appreciated and fantastic, and the nurses and everyone. And, we'll continue to do what we can to help our community.
Dr. Ismail Mehr, everybody said in the beginning this was going to affect senior citizens the worst. As far as that goes, what are you seeing when you see COVID-19 patients? And I'm talking ages here.
Yes, so, I would say majority of our patients and people that we're seeing, and you have to remember, there's not just patients in the hospital or coming to the ER, it's also the patients who have tested positive but do not need to be hospitalized and are being quarantined in the community. When you go on the Steuben Health website, you see how many are being quarantined. I'd say the majority are 60 years to, in the mid-80s to late 80s. However, what we're seeing is it's not identical or like Italy, where it was almost very exclusively senior citizens over there, a small portion of younger people, and majority of the young people in Italy were healthcare workers being affected by it, who are on the front lines. We've seen our share of 30-year-olds come through Hornell and in the surrounding communities that have been COVID, have been severely sick, have required to be intubated and transferred out. So it's not, if you're young and you're in your 30s, 20s, 30s, don't assume you're not going to get really, really sick from this disease. It's hitting everyone, elderly a little bit more so, but it's definitely not what I really thought and what we were seeing from Italy, that it was strictly 90% plus old patients. No, far from that.
Talking to Dr. Ismail Mehr. Executive order coming out of Albany from Governor Andrew Cuomo, where medical students, I'm not sure if he signed this yet or not, or if it's going to be signed, the medical students studying to be doctors who are about to graduate will be allowed to become doctors. What can you tell us about that?
Yeah, again, there's multiple executive orders, and there's been a lot of craziness on social media, and that gets revolved around politics, and I tend to stay away from that. It just, it does no good to bicker back and forth on what should and shouldn't be done. We're here to do our job as healthcare providers. But in terms of this specifically, medical students are set to graduate in May, and this is April. So if you're in your fourth year of medical school, you're basically done. And you're going to be going onward to your specialization to a university teaching center where you're going to specialize in, you want to be a pediatrician, a surgeon, an anesthesiologist, an internal medicine doctor. So they're all ready to go train now. So it's very similar. I'd take the analogy, if you were in the military and you're in boot camp and a war broke out, you might get out a few weeks early and, you go work. These medical students, if the executive order is put into effect, they would be working on July 1st in hospitals anyways, working under senior physicians, as what we call attendings in the medical world. So they would function as basically residents who are in training as junior doctors, working alongside and underneath the providers who are, senior and are full-fledged licensed doctors in terms of completing their residencies and training. So I think that's a smart idea. If you're short on medical staff, medical students who are literally 30 days away from graduating, they would graduate in May and would not actually start their residency until July 1st. In between, let's use them. They'll be a huge help.
Want to talk about the whole breaking quarantine issue that's come up in Steuben County over the weekend. Steuben County Manager Jack Wheeler put out a statement asking people, please, whatever you do, if you want to, I'm summing up, he said a lot of things, but basically, if you're one of these COVID-19 patients, please don't break the quarantine. Dr. Ismail Mehr, I wanted you to weigh in on that. I know you work with the COVID-19 patients. I can imagine the cabin fever is harder than hell. I can imagine being cooped up in a situation, in a place all by yourself, and maybe some of them don't have a whole lot of people to talk to on the phone. I don't know, but it's a bad thing. Your thoughts?
I understand all that. I think we're all cooped up, right? Even the ones of us who are not COVID-19 or possibly positive that need to wait out our test results and get put in isolation. When it comes to being quarantined by the Department of Health, the County Department of Health, because you are positive for COVID, that's very serious and very important that you do not go out. Unfortunately, someone did, and people broke the quarantine, I've heard, who were awaiting test results. You are going to infect other people. You are going to make other people sick. You're going to make other people become critically ill that we may have to do life-saving measures on. So, I don't think there is no exception to that. There's nothing which can justify that you needed to get out of the house and go out because if you're in quarantine. I think the message from the county was very, very poignant and hopefully people heed. that advice, because I could only imagine that if it continues to happen, that I'm sure public health officials and potential law enforcement officials will look at it to deal with it in another way. Let's hope that those were some mistakes and that they won't happen again, and that others won't follow suit.
Yeah, and I hope I wasn't too easy on the idea of people breaking a quarantine. I'm sure it is very difficult to be under quarantine, but like Dr. Ismail Mehr just explained, it really is a life and death situation. And as boring as it might be, if you're out there and you're listening and you're quarantined, really, it's life and death. And you really, when you think about it, you could kill somebody, and quickly.
Yes, absolutely.
Talking to Dr. Ismail Mehr on a more positive note, Dr. Mehr, Headlights for Hope happened in Hornell Saturday night. Can you tell us about that?
Yeah, I think it was actually Friday night.
Okay, Friday, yeah.
A classmate of mine from high school, Lisa Sexsmith, and then also Marika Clark-Woolever, one of the teachers down in the intermediate school. I just saw their Facebook. They had, between the two of them, had posted on Facebook about, hey, how nice it would be to get in, to show up at the hospital and in our cars and keep social distancing and flash our lights and honk our horns for the nurses changing shift at that time. And, of course, everyone else in the hospital. It's not just nurses. It's technicians, pharmacists, our environmental service people, our administrators, you name it. There's people going in and out of that building every single day. We're busy. We have a lot of COVID patients. We have a lot of just patients who need to be hospitalized for other reasons. And it was really, really touching that they were sort of putting that out in the community. I saw it about 5 o'clock when I got home after a long day at work. And all of a sudden, I went there with my kids, figured we'll get them out of the house, and there was 50 to 75 cars. And as always, Hornell is just an amazing community. We always come together. We see, we're Hornell strong, and it was just a great support and just show of love. And I think I talked to many of my colleagues, and some of them teared up or got close to it, and it was just a nice moment. And with that, I would say there's positives, right? We've had COVID patients come through the hospital and stay some time here with us, and then get discharged and have gone home. I think we've had 2 or 3 have done that. So it's not all doom and gloom. And I think maybe people think that that's all I'm painting out there at times, or we as healthcare providers. There's there are positives, but the issue is if you don't contain this virus, you don't mitigate it, the sad stories will continue. We don't have a medicine. We don't have a vaccine. This thing spreads so fast. So we apologize if at times it comes across as all doom and gloom, but it's like a grass fire. If you don't have the fire engines to put that out, it's going to keep going until you run out of dry grass, so to speak. You know what I'm saying?
Yeah.
And this virus will keep going until it runs out of people to keep transmitting to, until we can get a hold of it.
Dr. Ismail Mehr is with us here on the Newsmaker show again this morning. I frequently will repeat a guest name so the listener knows who it is. Dr. Ismail Mehr has been on so much lately. I'm not sure I still need to do that. We had 9 cases announced in Steuben County on Sunday yesterday, bringing Steuben County up to 73 cases from yesterday's count. 2 new cases in Hornell, 1 in Hornellsville, 1 in North Hornell, 1 in Fremont, and then 4 over in Urbana. Most of these cases happening in the Canisteo Valley area. Dr. Ismail Mehr, there's different theories on that. Do you have one that you'd like to talk about, or would you rather not talk about it on the air? Your thoughts?
No, I don't really have a theory necessarily. If I ever one of my thoughts is, it's not concrete scientific evidence. I think Hornell, there's a lot, community, a lot of maybe movement back and forth between different parts of the state, at times. Not that other cities and towns don't do that, but we are closer to Rochester. It's, like I said, there's no scientific theory behind it. It's here. It's happening. I can't really look as a healthcare professional to really try to figure out why it's here. I got to really figure it out. And we've done that, is what we're going to do and what we're going to do moving forward as it continues. I will say this, that if the significant number of this is here in the Canisteo Valley, that means that number is going to increase because it's going to go up until you reach a peak and then come down. And it's very hard to predict right now where that peak's going to be. We're seeing a steady amount of it still coming through the hospital. Every day we think we may not have any COVID-19 patients coming in through the ER or people that are really sick, and all of a sudden, yes, hey, we have a few more admissions coming up, or we have a patient that needs to be put on a ventilator. We have a very good system thought out and a process, and we have amazing nurses and technicians and radiology techs, and you go across the board that it's orchestrated. It's sad when things are going bad, of course, for the patient, but we know what we're doing, and we're moving, and we're safe, and we're protected, and we're taking care of these patients and getting them up there. I know Frank Brzezowski, our chief of the fire department, I saw him, as we're taking care of patients, came across each other, and he was sharing how appreciative the University of Rochester Strong Memorial ICU doctors are when unfortunately they do have to receive some patients from Hornell, in terms of how well they've been managed and how we've prepared them for transfer and all the steps that go into that. So kudos to everyone at St. James for being able to go through a crisis. Remember, rural hospitals aren't set up for pandemics, and they have to become ready for that, and we were able to do that. And so I'd like to share that with you all.
That's a great point, Dr. Ismail Mehr. Small town hospitals are not set up for pandemics, and you guys have done a great job. Stay with us. We're going to take a quick break. We'll be back in just a moment with Dr. Ismail Mehr.
Mullen Factory Direct Floor Covering has been serving this area for many years. During life's ups and downs, we've never quite experienced anything like this. There's no official day or time set for us all to go back to business as usual, but Mullins wants you to know they're there for you and your flooring projects. And it's also a good time to say thanks to all the loyal customers and remind you to support all area local small businesses to help them stay afloat during this unprecedented time. Be safe and stay healthy from your friends at Mullen Factory Direct Floor Covering in Almond.
Dr. Ismail Mehr, our guest in this special 1-hour Newsmaker show. Coming up at 8:30, it'll be Dr. Robert Welpley, who will give us some coping skills on how to deal with the cabin fever situation. Dr. Mehr, the Steuben County Public Health nurse said in yesterday's press release, the Sunday press release, that the most recently announced COVID-19 patients were good about not going out, and that they followed the protocols, and that resulted in limited public exposure risks. So much so that Darlene Smith, the public health nurse, did not have to list all the public places that COVID-19 patients announced on Sunday had been. She also said that we're noticing more and more cases coming out of the nursing homes in Hornell and also in Bath. And she said this indicates that many are following the social distancing rules of staying 6 feet away. She says, please don't go into grocery store in groups, but shop solo. Remember, this kind of thing saves lives. Did you have any thoughts on shopping solo, as they say in these statements from the public health department? And did you have any thoughts? Well, let's start with that, and then I'll get to the nursing homes versus getting it at a store.
Yes, no, I absolutely. I think I've been saying this for a while now, and the rest of my colleagues in healthcare, we all know we have to go to Wegmans, and we have to run into Walmart to do some shopping, right? I mean, those places are open because they are essential. However, go by yourself. Don't go with your wife and your children. Don't bring your parents along if you're shopping for them. Go yourself. Get in there. Get what you need.
If I could add to that, don't go shopping around for prices to see which store is cheaper.
I would say that. I mean, again, everyone is in their own situation. I would just say, go in, get in there wherever you need to go, get your shopping done, don't mingle, and get home. I know there was a lot of flurry of activity on social media about how busy Walmart parking lot is and Lowe's and Wegmans and stuff. And I hope people understand is go for essential stuff. Don't go to Walmart because you want to do summer clothes shopping or things like that. I'm sensing most people are smart and responsible. Get your groceries, get your things you need. We all need stuff, and come on back. I'm guilty of it in terms of I need to go to the grocery store, so it's not necessarily guilty, but we go. And so in my house, I get the honey to-do list and run out and get those groceries and come back home, most of the time. And that's what everyone should be doing, and I think they're enforcing that a little bit more at the stores in town. It was unfortunate. I think at times there was multiple families or kids, teenagers, or college students getting together and say, hey, at least we can go walk around Walmart and catch up, possibly. But I think sensibility is prevailing. And to follow up on your remarks about nursing homes and whatnot.
Yeah, the public. If I could jump in, Ismail, the public health nurse says it seems like more cases are being announced from nursing homes in Hornell and Bath, as opposed to somebody catching it from going out someplace in public from somebody. Your thoughts?
Yeah, so we saw this in Seattle, right? That was the first crisis we had in the U.S., a very small epicenter. We saw that there. Nursing homes they're first of all an older population. Some may be immunocompromised, and they have a lot of comorbidities. As you get older. So if one patient gets it there, and before it's suspected that one has it, this is again the whole point about COVID. You may have it and not even have symptoms, so you're transmitting it to other people. And nursing homes, there's community get-togethers. Staff is coming in and out of the room. You somehow you have the infection. You don't have symptoms yet, and now that staff, totally not their fault at all. But it spreads human to human. So, and then all of a sudden you start getting the cases, and that's obviously you immediately clamp down and you put the isolation and stuff in. But the damage has been done. So I think some of this fallout in nursing homes, not just here locally, it's happening across the country, is because. Asymptomatic people have come in to visit family members, or asymptomatic people within the nursing home had it early on. Obviously, right now, no one's visiting and going in and out of nursing homes. But early on, this is what sort of causes spread. And that's the message, people, you're asymptomatic. You don't even have a sore throat. You haven't sneezed in weeks. You could have the virus, and you could potentially infect others. That's why we need social distancing. And that's why we've been doing that, and I think we're seeing that. You just saw Darlene Smith mention she'd have to list all the names of places where people have potentially visited because they weren't out, they weren't going to those places. So that's showing that we're getting it, and we're doing better here locally in our county.
We're down to the last couple of minutes here. The phone number to call the University of Rochester UR Medicine, they now say, phone number to call to get screened by the doctor or nurse who answers. I'm not sure which it is. If you need a COVID-19 test, the number is 888-928-0011. Dr. Ismail Mehr, if they call, do you know if they get a doctor or nurse? I'm not sure.
Yeah, I'm not. I haven't called it myself. So University of Rochester has a COVID hotline, and Steuben County Public Health has a 24-hour/7 hotline as well. So what they do is, and this is what should be doing. Instead of everyone just showing up at the ERs that I think I might have COVID, I need to get tested. You're only exposing, if you do have it, your infection to others. And let's say you don't have it, you're potentially being exposed to maybe someone who has been there. And you're not following the social distancing by just sort of showing up to get tested that way. What these numbers and hotlines do is they work through your symptoms, and they have a checklist. They have they know if it's fitting the trend or not. Based on that, they'll get you to they'll tell you to go to the emergency room or urgent care if you're in Hornell and to get tested. There is still a shortage in testing. I know we're hearing and we're seeing that we're doing a lot of tests. We are in the country, but we're still short. There's still a tough criteria that has to be met to get tested. I've said this, and I've said this before on the radio show, is I wish we weren't in that situation and that anyone who had a remote of a symptom could get tested, but unfortunately we're not there yet. So calling this hotline helps assess who needs to be seen and tested and who doesn't, and also helps you not have to go out of the house, follow social distancing, and if the public health official or the physician nurse or mid-level healthcare provider at University of Rochester feels that you're okay and you don't need to go tested, that way you don't need to go out and you can stay home. And I think these hotlines are essential. And I suggest to everyone, if they have any worries or concerns before going out, to call the hotline, either Steuben County or University of Rochester, and they will guide you.
The Steuben County hotline number, 888-364-3065. Dr. Ismail Mehr, out of time. Can't thank you enough for coming on.
No worries. Thank you. Bye-bye.